Hello, welcome to today's lecture on infertility and treatment of infertility. At the end of this lecture, students should be able to describe common causes of infertility and explain common treatments for infertility. So let's begin by looking at common causes of infertility. Infertility can be caused by many factors. These include sperm issues, ovulatory issues, tubal damage, endometriosis, coital problems, and other unexplained phenomena. Male infertility is defined as an inability to fertilize an egg and results from a sperm count of less than 20 to 25 million sperm per milliliter of ejaculate. Keep in mind that normal sperm levels are 50 to 150 million sperm per milliliter of ejaculate. Endocrine disrupting chemicals are environmental agents that interfere with natural hormones and may disrupt reproduction, development, and homeostasis. Endocrine disrupting chemicals can be from dioxins, phthalates in plastics, flame retardants, phenols, polychlorinated biphenyls, pesticides, polyaromatic hydrocarbons, and phytoestrogens. In the male, endocrine disrupting chemicals have been implicated in cryptorchidism, failure of the testes to descend, hypospadias, location of the urethral orifice on the ventral aspect of the penis, low sperm count, low sperm motility, and testicular cancer. In the female, endocrine disrupting chemicals have been implicated in premature breast development, premature menopause, breast cancer, uterine fibroids, endometriosis, and disrupted ovulation and lactation. Clearly, endocrine disrupting chemicals are not to be messed with. Treatments for infertility are multifold and have varying success rates. In vitro fertilization, or IVF, is a form of fertilization where an egg is combined with a sperm outside the female's body. IVF involves monitoring and stimulating ovulation, removing ova from the female's ovaries, and placing the ova and sperm in fluid in a dish. The sperm can then potentially fertilize an egg. Any fertilized eggs, now called zygotes, are grown in a nutrient solution for 2 to 6 days and are then transferred to the uterus of either the same female or a surrogate. Ideally, this results in implantation and a successful pregnancy. Intracytoplasmic sperm injection is a specialized subtype of in vitro fertilization in which a single sperm is injected directly into an egg. The remainder of the IVF process is the same. Intracytoplasmic sperm injection is an ideal treatment when the causative factor of infertility is decreased sperm motility. Artificial insemination is an in vivo fertilization procedure in which sperm is intentionally introduced into a female's uterus by means other than sexual intercourse. The sperm often comes from a sperm donor. That brings us to the end of our infertility and treatment of infertility lecture. Students should now be able to describe common causes of infertility and explain common treatments for infertility.